COVID-19, or the coronavirus, is spreading across the planet. Officials say it is probable that Hawaii's caseload will grow. What are we doing as a community to inform and protect Hawaii's people? Should we rely on the government for all our needs? How will Hawaii survive the predicted economic downturn caused by the virus? Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha, and welcome to Insights on PBS Hawaii. I'm Daryl Huff. People are getting sick, businesses are cutting back or temporarily shutting down, and there are already layoffs, hundreds of them. COVID-19 is here, and experts predict it is just getting started. One constant in all of this is change, including here at PBS Hawaii. We have changed our set for this program to create more distance between me and our guests and between the guests themselves. Two guests originally scheduled to appear tonight will not be here because of possible exposure to the virus. We are fortunate to have gotten replacements, and we invited the superintendent of schools to participate, but were told that she was not available. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Lieutenant Governor Josh Green is liaison between the state and the medical community. He is an emergency room physician and former chairman of the State Senate Health Committee. Bruce Anderson is the state health director and has been a leader in healthcare and environmental health in Hawaii for more than 35 years. Eric Gill is the leader of Unite Here Local 5, the union representing hotel, healthcare, and airport workers who are among the most impacted by the crisis so far in Hawaii. And Dr. Stephen Hankins, an assistant clinical professor in family medicine and community health at the UH Medical School, where he earned his medical degree in 2001. He also has a lot of experience in disaster management and public health. We start, Dr. Anderson, you have been updating the public on a regular basis on where we are. Can you tell me where we are now as of the positive cases that you found?
I can tell you where we are now as of noon today, Daryl. Things are changing, as you point out. We've had 26 confirmed cases of COVID-19 so far. 10 of those were identified today. We've recently, the state has available to it private lab testing, and over the last few days we've sampled, and people have submitted over 1,000 tests for COVID-19. So that increase that I mentioned, the 10 new cases, is undoubtedly a combination of both the increased prevalence of the virus here as well as the number of tests that are being done. One thing that I have to say is in common with almost, in fact, all the cases that we've had a chance to investigate is that they all have a travel history. They're all traveling to some place where the virus exists and is traveling through the communities, or they've been in contact with individuals who have exposure to travelers.
So let me ask it this way then. So what you're saying is that of the 1,000 tests that you know of so far, we have 26 positive, and all of those 26 positive, I mean, all the other like 900 and, I can't do the math that quick, 974, something like that, have come back negative. Of the 26 that you have, none of them are more than 1 degree of separation from someone who traveled. Why is that important?
Well, it's important because one of the things we're most concerned about is community spread, having disease being circulated in our community without any exposure to someone outside the community. That's a turning point that we may be reaching very quickly. We have cases of individuals returning residents. We've got people who are travelers, basically from other countries, coming here with the infection. And that's a concern, of course, and we typically will investigate those individuals and any contacts they have, and most of them end up in isolation, and hopefully we're able to stop the transmission occurring from those individuals. But once it's in the community, then it's being spread, and it's hard to know who the contacts are and where the individual may have been infected. As I say, we have no evidence of community spread at this time. That's our best guess.
But today you said no evidence of widespread community.
Yeah.
I mean, that distinction was made more today.
I should have made that now. Let me add one more thing. We're doing what we call Sentinel Surveys. This is a survey that we do when we're looking for the prevalence of a disease in a community. We basically pick random samples of people with respiratory disease. We test them for COVID-19 and try to determine whether they are infected. These are individuals who have respiratory illness who do not have the flu from around the state. And so far we've tested 124 individuals from around the state, and we haven't found anyone to be positive. And that's actually good information and helpful to us in identifying where we are. And I might add, in addition to the 1,000 or so private tests and the Sentinel survey testing, we also have our own testing program where we essentially follow up on serious cases.
Okay,
So
let
we
me
have
move
those.
on. Lieutenant Governor Josh Green, as a doctor and also as someone who is involved, do you feel like we have a clear picture of what's happening with this virus in our community?
We don't. Let me preface this by saying the Department of Health is working extremely hard, and no one can express how much it's appreciated. But we have a catastrophe on our hands that's about to happen if we're not careful. We're not following the World Health Organization guidance to get testing widely. We're not testing every contact of positive people, which is how they prevented catastrophic spread in some places like Singapore, like Taiwan. We are headed down the road, if we're not careful or if we get unlucky, towards where it is in Italy, where we don't have enough ventilators and we have to make the choices between life and death between two individuals who are old and can't get on a ventilator because we don't have two ventilators. We're in big trouble, and you're going to have to indulge me here. We're in deep trouble. Today we found one of the senators had been positive, as we know. He was in touch with hundreds of people, and we don't have a clear standard to test all those contacts. What's being done in states or nations where it's successfully being curbed, where they're getting low rates of fatalities, is massive testing. It is beyond me, beyond my comprehension, beyond the comprehension of all the leadership that I'm able to talk to, and they're irate about it.
But let me ask,
Yes.
my understanding of the reason for that is because the federal government has been extremely stingy about the tests. Their tests were messed up the first time.
That was only in the beginning. I'm sorry to interrupt. That was absolutely right. The Department of Health did have great restrictions on them because they sent the wrong tests, and then the tests were broken. But once that lifted and we've had private sector capacity, we have not taken the position, even today, from Dr. Park, who is a very, very intelligent person and a hard worker, we have not had the position.
That's Sarah Park, the
Sarah Park, yeah.
state epidemiologist.
And this is a very large problem, which is being resonated through the community, and we have to be honest about this. We have to really be honest about this. The expectation that we're only going to test people who are severely ill, when we have people in the intensive care unit who get rejected for their tests on multiple occasions. I'm a physician, I talk to those providers, is a big problem.
Well, let me ask though, I mean, I hear what you're saying, but at the same time, when they have tested, it seems like so many of them are coming back negative.
Some are coming back negative, absolutely, and some are coming back positive. And also, we've only started testing from the private labs last Thursday, Friday. If we hadn't, for instance, tested the senator that came through, we would not have known that the 500 to 1,000 people at the Capitol and all those hearings would have been exposed. That could go exponentially badly for us.
Let me ask Dr. Hankins, as a physician who actually has patients calling you up and saying, I want to be tested, I want to be tested, do you feel like there's not enough ability to test?
Well, there's no doubt. I think the Lieutenant Governor's point that we really want to get more tests available as quickly as possible so that we can get a much better handle on the true epidemiology is very important. So, you know, even in countries that are responding fairly robustly, you're truly only sampling the tip of the iceberg in a sense. And in some ways that's very scary. There's the sense of what's the unknown. But also, you know, understanding that for the vast majority of people who are not elderly and who don't have underlying disease, they are going to have this virus, have a bad cold that lasts for a while, and they're going to get over it. And that doesn't mean this isn't serious. Absolutely. We see what it can do in places like Italy, where for whatever complex, and that's the thing, is the complexity is there, but that they weren't able to get all of the right pieces in place to protect the vulnerable people and to get the amount of information they needed, get that distancing. And we've had some lead time, fortunately, that they never had. So I think keeping those in mind. But for the general public, absolutely, there's a lot of anxiety. And I think it's really important to separate out the difference between a pandemic and a panic epidemic. And, you know, a lot of folks, when they hear these things...
Do you think we're having a panic epidemic?
I would say that we're pretty close. I think we need to, you know, we definitely, again, very serious measures, take the right steps. But if we do that and do that well, then I think we can be very effective. And so changing the way that we're delivering the health care so that we are protecting the vulnerable populations.
So focus on the vulnerable.
Making sure the vulnerable stay safe, and making sure that we don't have so much disruption in the continuity of operations to be able to deliver the health care that saves lives every day.
Let me ask,
That's
Eric
really
Gill,
important.
as you're not just a leader of the union, you actually are very close to many of these people. From what I understand, that one of the people that was supposed to be on our show is someone who works for your union, not tested positive, but, you know, got close.
Yeah, you're stuck with me because we sent her home after she was down at the Capitol all day and has been for the last period. We try our best to engage, but of course, you know, there's no way to test that person because they won't order the test. And therefore, as an employer, I don't know. Should I have her home? Should I send other people home? All of them are worried about bringing the virus home with them into their homes. So the question about testing is not just, with all due respect, I'm surrounded by medical professionals, but people got to know if they're sick. And if they don't know what to do with their families. You know, should I isolate myself from my family, for example? I'm in my office. There's hundreds of people coming in every day because they're unemployed. They're looking for help. How many of them might be exposed? I don't know. But I don't know if it's safe to go home. And I don't have any way to get tested until I exhibit symptoms. And by that time, I might have infected my family. And this is a situation that our members are in and everybody's in. We have a medical emergency, and I'm not going to try to offer an opinion when there's so many doctors here about the medical aspects of that. But we already have an unemployment crisis. You know, our union represents hospitality service workers. And on the call that I had yesterday with my counterparts across the country, between 80 and 90% of our members across the country are unemployed. You know, 50,000 union members in Las Vegas are unemployed.
I think there was a story in the paper today that said, 25% could lose their jobs. It's highly likely that there might not even be 25% in their jobs.
It's quite likely that we won't have anybody in our jobs. They closed the casinos in Las Vegas. Nobody is working. The place is deserted. The building is dark. Now, those employers are paying people to stay home and covering their medical. I got hundreds of people laid off in the hotel right now, and the company is not committing to cover their medical going forward. And nobody's getting paid to stay home. Everybody's on unemployment. And we're talking about spouses as well. And so the real impact is already there on the economics and on people's lives, regardless of whatever the medical issues are.
Let me give Bruce Anderson, the health director, a chance to respond to some of what we've heard here. It's been sort of a round robin pile on here.
Well, I think one thing Lieutenant Governor and I can agree on is that this is a serious pandemic. It shouldn't be taken lightly at all. The end game here, and I'll tell you what we're looking at, is that either we're all immunized through a vaccine, which is not available, or the disease will have taken its course and spread through our population, and we have developed a immunity as a community naturally. That's the only way this is going to end, one way or the other, which means effectively that our choices here are to spread out the disease to avoid a huge stress on our medical community, or let it play out in a more gradual way, flattening the curve where we don't see as much stress on the medical community. but I don't think anyone who's looking at this issue thinks that it's just going to go away or there's anything we're going to be able to do to stop its progress. It just depends on how quickly that happens. And I think that's critically important. I hear people talking about sheltering at home and so forth. We're not dealing with a natural disaster that we're going to be able to duck down and have pass over us. It is coming, and there's nothing we're going to be able to stop it except to mitigate its impact as we go.
Let me ask you though, Bruce, what I heard from all three of the other members of this panel was that we can test more people if we reduce the standards that you place. Is that your standard, or who's setting that standard, and could it be loosened up?
Well, let me first say, of course, there's a limit to how much testing we can do simply because we don't have the supplies and equipment and personnel to do that.
What's the limiting factor?
But let me say one more thing.
Okay, sir.
There's no value in testing someone who's asymptomatic. There's zero. We could only expect to find the virus in someone who is symptomatic, one way or the other. So we're wasting a lot of resources if we're not just testing people who are symptomatic. Now, let me also say that we as Dr. Green have pointed out, our initial focus was on people with serious illness. And what we probably missed, and what we're seeing now, is there are many others who have less serious illness that are being picked up through this private testing in the community. So I think there's a great value in expanding the tests, and we're all in favor of that. But there is a limit on the number of test kits and so forth that's available, and we have to focus those on those who are most likely to be infected, and that's what we're doing right now. That's why not everyone can get tested when it comes to it.
Have you responded to that?
First of all, thank you, Bruce. We have to have a moment of great clarity here, okay? What Bruce just said is accurate. We do all agree that this is a problem, it's a crisis, but what is not accurate is that we are all in favor of testing. And Dr. Park has fought me all the way on testing, and this is a moment of clarity where we have to be honest with ourselves. If we're not honest with ourselves, we should get out of the way. At every turn we've met, and I have tens, if not hundreds of providers have told me over and over again their tests are being rejected. There was a press release today that said, no, we will only test people with severe symptoms. In fact, I believe I read it in the Advertiser today that the insistence was we should not even test people who are symptomatic or have had contacts unless they are severely ill. Now, as you've heard, there is a lot of benefit, and the World Health Organization is telling us over and over again that there is benefit to testing. And it is important that we recognize that if we, flatten the curve, decrease the spread for a time, we will get a better result from our healthcare community. However, we can get some immunity for individuals. And if we don't, if we allow this to go up steeply and come down steeply, not only will we totally overrun our system where we have only 500 some ventilators available in the whole state, I believe only 18 on the island of Kauai, we will die. We will die here. The mortality rate for seniors, I beg to differ in a certain point. I know we're on the same page on some of this. Yes, the mortality rate is not like Ebola, okay? But 1 out of 1,000 people dies of the flu or less. But at this moment, 3 out of 100 people who get coronavirus, COVID-19, are dying. That's 30 times as lethal. Now, once we get a lot more diagnoses, I know that number will come down. It is much more lethal than the flu. We don't have an immunization, as Bruce very pointedly brought to our attention. But in the countries where they tested widely and tracked people, like Singapore, Taiwan, they were able to beat it. They were able to prevent mass casualties and mass fatalities. In our senior population, the mortality rate between age 75 and 79 is 8%. That's 80 out of 1,000. And if you go over 80 years old, it's 14.4%. That's 140 times more lethal than a common flu. Now, of course, we have to be careful about our resources, but we are making a terrible, terrible mistake right now, and so many people in leadership are pointing this out, and for some reason, we're resisting it. And that I'm not going to stand idly by and watch this happen. It is a tragedy, and if we let this happen, and then we go downstream and we have mortality rates like we're seeing across Europe, we're going to be sorry forever that we did that to our ohana.
Okay, I have to move to, I've got a pile of questions here. We promised our audience we would answer their questions, so there's quite grave things we're talking about, but let's get these questions. First of all, what are the symptoms of a carrier if any? How do you know if you are one? Doctor?
Sure. So, there are still unknowns, and one of them is, so we have a really good idea about the time it takes on average from the time you pick up the infection to the time you start to show symptoms, which is about 4 to 5 days. We do know that there is probably, and so that's a pretty short window when you think about it overall. And how early from time 0 to the time that someone is able to spread is not very well defined yet. We do know that in places that have done a lot of testing, like in South Korea, there has been some evidence that there might be some spread among uninfected individuals. But again, when you get a bigger picture of the iceberg, again, in most of those communities, and there's a lot of variability, there's so much complexity to the way that a disease interacts with a community. And this actually really goes back to the economic impacts and the social determinants of health, and as those get affected, all the other reasons that people are affected come into play. We really don't know exactly, and so, but as soon as somebody starts, fever is usually the first thing that comes up. Cough is usually one of the second, and so fever, cough, and then having shortness of breath. Those are sort of the most common. Some of the other symptoms that go along with all the respiratory other illnesses, and we've got several of them circulating right now, including flu, that makes it a little harder to sort out. Can be there, but in much smaller proportions.
Let me ask, anyone can pitch in on this, Bruce. The specific question is, can you get COVID-19 from the handle of a shopping cart? But I think that goes to the general question of how does it get passed around?
Well, Steve or Josh can answer that probably, but the best evidence we have is it's mostly transmitted through droplets and aerosols as you cough and sneeze. That's the most common way. That's why we're sitting 6 feet apart here, is because that's determined to be the distance in which a droplet would potentially pass there. But having said that, they're still looking at the issue carefully, and they know the virus can survive on different surfaces for hours or even days. And of course, you can touch it, get it on your hands, and of course, and like I touch my face all the time, unfortunately, and that's another way of getting the disease. But most often, it's through respiratory air tract infection, through your respiratory system, and passing it person to person through the air. That's invariably the way it's mostly transmitted.
Eric Gill from Local 5, what's the concern in among your folks about how they might get it from say a hotel guest or someone working in a restaurant?
Well, sure. I mean, we've had people complain. I went to the room and the guest is coughing. Am I supposed to change the pillows? Am I supposed to work in those conditions? And we're getting conflicting advice. I mean, I'm not blaming that on you, Bruce, but our Surgeon General said don't wear masks, and yet if it's true that then it would be good if people masked up, because then they wouldn't transmit. But yeah, people are very concerned, and it's largely because nobody really knows, and so it's kind of like fighting a phantom, and it's compounded by the fact that the fear is eliminating our jobs. Mm-hmm. Even if this thing is contained, how long is it going to be until tourists start to travel again? And how long is that going to take? And are our hotels going to be able to survive to reopen? Because I believe we're going to see a whole bunch of hotel closures. We got hotels in the single digits now. And I'm being told by
single digits of occupancy.
Yeah, and I'm being told by big operators that we're not sure we have money for payroll, much less for the additional contributions I'm asking them to make to keep people on coverage. So it would be a disaster in this community if people lose coverage. I got thousands of people on coverage now. We know how to fix it. It takes some money. The hotels are saying they don't have the money.
I heard from a restaurant worker today who said that they're all being laid off tomorrow. And they'll be given they'll give them a pamphlet on Cobra, and that's the extent of their coverage. I mean, will a lot of these people lose their health care coverage because they can't?
Well, not immediately. In our hotels, under our trust fund, we have reserves. We are worried about people losing coverage in a couple months when this thing could be much
But that's
worse.
for your union members, right?
That's for our union
members. What about
members.
a non-union place?
Yes, non-union people don't have that benefit because our trust fund has the ability to extend people's coverage. But anybody who's on a month-to-month pay plan on April 1st, they're out of coverage.
Okay, Lieutenant Governor Green, I'm going to direct this question to you because I think this is in the sweet spot of your swing right now.
Yeah.
How can anyone say there is no community spread since there hasn't been widespread testing? The official response to this crisis has been pathetic. That's an email call. Another person was asking, how much does the test cost?
Yeah.
And, if you did widespread testing, let's say everybody who wants a test gets a test.
Right.
How does that change how you end up responding? And how do you respond to the question that I've heard raised that we're already short of supplies for every time you do a test, you have to throw away a swab. Every time you touch a patient, you have to throw away your gloves. And so is that a real limiting factor?
No, actually. That is used as an excuse constantly. We have plenty of rubber on the planet to put rubber gloves on people. We have plenty of tests to keep our people safe or not from spreading it to their loved ones or their coworkers or their tutu or their kapuna. Those individuals that end up in the intensive care unit may pass, or they will cost hundreds of thousands of dollars on ventilators. The states are already suffering great economic damage. Now, the reasons for testing, and I want to say this, the people that work at the Department of Health are not pathetic. They're excellent people. But the response has been less than satisfactory. It has been dangerous, mostly out of the gate because of the CDC's inability to get us the test. But let me be clear. The test costs about $120 to cast. There are many ways to get them cheaper. I had 2 separate governors call me today, though not our governor currently, demanding that we get more tests, and we get them immediately and from anywhere across the world, demanding. They're very well intentioned and they're right. Now here's the story. If you can test, then you can test everybody else who has been positive and their contacts. You isolate as much as humanly possible. It's true. We will ask anybody with any symptoms to isolate, but we don't build any confidence. One of the problems that we've had as far as this response has been, when we only got to about 30 people tested, out of the many hundreds that asked and the many thousands that were fearful, we set a terrible standard of a lack of confidence and a lack of trust in government. They didn't know that it was difficult to get testing, but when testing became available, and we still balked at that, and people are seeing what's gone on in other places where they did no testing and they were run over by this disease, they are definitely afraid. They're afraid that it's going to affect their families. And the fact that we can test and can intervene puts all of that certainty back into people's lives. We have also not done many of the things that would restore some confidence. They're not perfect, but when people say we're not adequately screening at the airport, they're correct. And that has been another area of confidence lost. It is very difficult. It is incredibly hard work that Bruce and his team are doing, but there are so many other resources out of the legislature, out of the federal government, all across the world that can keep us from seeing what Italy saw.
Let me ask Bruce Anderson, and I want to put this from the form of a question, and I will let you follow up on some of what Lieutenant Governor is saying. Woman is concerned that social distancing message is not getting to the Molokai community, people still hugging and kissing. We also saw in restaurants and bars in Waikiki, okay, well, the law doesn't require us to stop serving. We saw, people in jacuzzis. People are emailing our newsroom with pictures of tourists all sitting in jacuzzis together from last night, luau's with people sitting there. I mean, is the message getting through, or will people behave the way you want in order to hold down the curve the way you've described? If people don't, how much trouble are we in?
First, let me compliment the viewer for recognizing the importance of social distancing. We talk about how we're going to control this disease. We can test contacts, and we can do that until we just go crazy testing contacts. We have 10 cases today. I'd be willing to bet within days we're going to have 100 a day, and we can't keep up that pace. The secret here, and what every country has found, it works, is to establish good social distancing here. We've done a lot of things recently that I think are helping. All respect, you know, we don't like to close restaurants. It's really painful, in bars and other things. But people are searching desperately for things that could be done to enhance that. That's what's going to make the difference, and what has made the difference in virtually every country where they have been able to get a handle on this disease. So that's critically important. And let me just say one more thing. LG pointed out, you know, there is a lot more material and resources available to us than there was a few weeks ago. And we did focus on the seriously ill because we had a test kit that could do only a couple hundred tests per week. So we were having to be very selective. Now we can literally do thousands a day. But supplies are running out. Every state in the country is running out of everything from swabs to masks to eye protection and other basic needs. We luckily have a cache of supplies. Our hospital system has been, I think, very good about anticipating this, at least better than most places. But even so, the private labs we're using are running out of reagents because of the demand on those, and they're scrambling now to try to find substitutes and ways to meet the demand for the testing. So there isn't an unlimited supply. We still need to use the resources wisely. And one more thing, if I could, on the screening. One thing Steve mentioned is about the symptoms. Not everyone has a fever. That's important. So you start up a screening program, and you want to try to catch most people at least. You're not going to catch everyone.
When you say not everyone has a fever, you mean not everyone in the population has a fever, so people who have a fever are the ones you should be testing?
I'm saying that when you're talking about screening, most people think about thermal scanning an individual. That's what's typically done in a situation. You're not going to get the people who don't have fevers and are carrying the disease. Further, the chance of catching someone who's symptomatic, presumably got on the plane without any symptoms, they should be, and even if they aren't, people are getting sick at home. They're not getting sick on the plane where you pick up the fever. All the cases we've had here have been people who are either in their apartments or their homes or wherever they are. There's a 5 or 6 day incubation period on average, maybe 2 days to 14 days, and the chance of catching someone on the plane with a fever is very, very remote. So they're just not found to be effective. One thing the Lieutenant Governor has said, I won't have a difference with that, it is comforting to people to know that they are being screened. It's sort of I hate to say it, sort of a panacea, but people shouldn't have high expectations that a screening program is going to stop the illness from coming here. The social distancing is really what's going to make the difference at the end of the day. People are going to come in one way or another sooner or later, and we're going to have to deal with that as a community.
I think it was interesting the way it was messaged. I think it may have been out of Mayor Caldwell's administration that this is a team effort, right? This is you have to help. If the individual people who are out there are not practicing these practices, the hand washing, the not touching, and all that, just nothing's going to stop this. But Doctor, I want to put this again in the form of a question from a viewer. Is government monitoring capacity of hospitals in real time? Has capacity changed since the virus? I think that I can put that question out, to either of you gentlemen, but what's your biggest fear about an out of control coronavirus as a practitioner in the community?
Well, absolutely. The greatest impact in terms of loss of life, as the Lieutenant Governor has pointed out, is when our hospital systems get overwhelmed because those that are critically ill from the virus can't get the resources they need to, and again, the mortality rates are very high in those folks. But it also takes away those resources from the critical care work that we do every day and the acute care work we do every day.
On other sick people.
On other sick people, because those things aren't going to go away. Car accidents aren't going to go away. Drug overdoses aren't going to go away. Those kill 5 people an hour in the United States. And so we have to have capacities throughout the system. So working on the surge capacity, which is a very big part of what's going on, I will say I think the communication chain, obviously things can always get better, but has actually been quite good in terms of there are coordination calls that are made every day. We in our local community stood up, we reached out to other healthcare providers, whether it's the school nurses or the critical access hospital up in Kahuku, at the local community level, building bridges, sharing information, and then there are calls every day that the lieutenant governor does, and that gets really quickly transferred down to the hospitals. They've got representatives. So I think that part is actually working very well.
Let me, another question, and this comes up all the time. I have to say, about a third of the 40 or so questions I have here are about this testing issue.
Yes.
But I think we need to move on to some other things. But I would ask, can we purchase test kits from South Korea? They were testing 15,000 to 20,000 people a day.
I tried that. And interestingly, South Korea's chairperson, who's in charge of that, has Iolani connections and is dear friends with Mark Mugiishi. We've been rebuffed at every level to get tests from other countries. Governors Abercrombie and Waihee asked me today if we could do that. We should do it, and I will return. I'm apologizing in advance to the testing question. It has been shown in every state and country that's had successes that testing and testing cases of contacts can help us operate better and prevent the spread and prevent deaths. It's a fact.
You know, one thing that, Dr. Anderson, you said today that struck me during the briefing that I watched was, and this may have been Dr. Park who said this, we had 10 more cases today. We're real busy. We can't tell you anything more about these cases. And I'm thinking, 10 cases and your investigators are overwhelmed? I mean, is that a fair way? I mean, really, do we have the capacity to respond to this? Even if you got a bunch of positive tests, if 10 cases means you can't tell we can't follow. I mean, that was very concerning to me.
Yeah. Well, thank you for asking that, Daryl, because we are stressed as it is. We do have a great team at the health department. They're doing their best. They're working 24/7. You know, for every case that we have, we probably have on the average of a dozen to 100 contacts. The senator who was infected today is a great example of that. He probably came into contact with more than 100 people in the course of the few days that he was infectious, that is ill. To give you an example, and every one of the cases we have investigated, we've had many contacts. We have to call those contacts, ask them about their history, and it goes on and on and on, who they've had contact with. And to some extent that it works. It's worked actually really well, I think, so far to contain things to the point we're at. But we're going to very quickly get to the point where that's going to be impossible. We can't chase every case and every contact that case has had. We're going to be having to deal with community interventions and focus on the things that we've talked about, keeping people apart, making sure that their lifestyles are changed in a way that they're not exposing other people. And the social distancing, we keep talking about it, and people kind of get tired of hearing us talk about it, but it is really critically important. That's what's going to help overall in our dealing with this issue.
Okay, I need to.
Daryl, I gotta say,
Go ahead.
anxiety is a medical condition. We've got thousands of people who are worried sick.
Yeah.
And they don't know if their kids are sick. They don't know if they're sick. Should I go home and isolate myself from my family? Am I not supposed to hug my kids for 5 months? This is what's happening in people's hearts. This is a medical condition. And so with all due respect, Bruce, people will feel much more confident if they can take their kid and find out if they're sick now, so they can decide if they have to put them in a spare room and lock them up or move out or all those things that they may need to do.
Okay, they're interrupting. They're not going to know from doing a test if they're healthy, first of all, whether they're sick. And the only time that they could transmit the disease is when they're ill, when they're having symptoms. And they could also be infected. And a week later, they could be exposed, and the test would be meaningless. And that's the nature of our situation right now. The test is a flash point in time. And to your point, yes, it is probably helpful to people to know at this person, even if they have symptoms, at this point in time, do I have COVID-19? The doctors who are treating that person, as Steve pointed out, are going to treat them the same way whether they have COVID-19 or the flu. But they would probably know and feel better about that. But having said that, go ahead.
Okay, so
I could go on.
Can I just comment? So I think, Eric, you're absolutely right that anxiety is a medical condition, that as we go through more stressors, that puts us at risk for all kinds of illness. And so well-being and taking care of our our individuals. So as a family doc, you know, resiliency begins in the family and in the community. And if we focus on keeping people whole and well as much as we can through the stressors, then that goes a really long way. And you're very right to be worried about the economic impacts, because we know that those contribute to the social determinants of health that cause all kinds of illness for us. So we have to pay attention to those things. And it is reassuring on one level to get a negative test, but that doesn't mean, and it is true at that point of time, it's a good, reliable test, but that doesn't mean that you don't walk out the door and the next day bump into the virus and bring it home. But what the testing does help us do is create strategies to respond effectively and give us a sense for where we are in the epidemic.
Okay, I'm going to give Josh one more chance to talk about the testing.
Yeah, there's some other things here about the actual.
I got 20 minutes to
we
go.
do treat people differently. Okay, if I test somebody as I did this last weekend, I think I maybe tested 8 people when I was on call. If I find out that Eric is positive, then he is implicitly 30 times more likely at this point of dying than if he just had the flu, and infinitely more danger than if he just had a cold, which caused also very likely fever or runny nose or cough. So there's some very, very significant differences. And also how I follow up with him and how I anticipate what supports I will have to do for him and how serious he will be if I tell him, please do not go into the community, do not visit the nursing home. All of these things are very real differences. And the idea that we can just accept that people will not know whether there is a pandemic illness that has been quite lethal in a lot of different parts of the world is completely preposterous. Doctors do feel differently. We do want to know that he only has the flu or only has a cold, and we do want to know whether he's going to expose his wife, who might be the same age as him. These are absolutely real considerations.
Let me ask it this way, and then I've got to move on because
Yes.
I've got a lot of other.
Sorry.
No, it's okay. Is there evidence? Because this is a key question. I mean, what Dr. Anderson is saying is that if you get a test for coronavirus when you're not symptomatic, it won't come back positive.
Right.
Right?
Most of the time, that's correct. Yep.
Okay, so the idea that we would test all the contacts, even if they're fine, you're saying that you should do that?
No, I'm saying that first of all, we do wonder whether people will be sick slightly before or slightly after their main symptoms are. But Bruce is absolutely correct. People shed the most virus when they are febrile, feverish, when they're having that cough, or when they're shortness of breath. They have shortness of breath. That's the overall arching understanding we have of all viruses. But we're asking a totally different question. First of all, in the case of the individual who's sick, we should test them. We should absolutely test them and isolate them if they're positive. And we should isolate them if they're just sick, but we have less concern. But for individuals who are contacts, who we will watch, it is very difficult to know. A lot of those people are going to have colds. A lot of those people are going to have flu. But a lot of those people also have very serious considerations in their lives. And so we have to watch them very carefully and at least be prepared to test them. And so we saw dozens and dozens of people in a panic. And if we can quell that somewhat, it's valuable.
Okay, so a bunch of these questions are about basically closing the border, right? All about people, how do we keep people from coming in at the airport? How do we get people off the cruise ships? Why aren't we screening people at the airport? Should we have shut down the visitor industry earlier? Stop this. Bruce Anderson, do you feel like these measures that we're doing now are happening fast enough? Would we have been better off doing this a week ago? Sort of like, we know the economy is going to go into hibernation. It's going to go into hibernation, right? What's the difference if we did it 2 weeks ago versus
Well,
now?
look, I think we'd all agree that we need to do things quickly here. We don't have time to waste on this. What we're finding is we're maybe a week or two behind New York in terms of what's happening, or Italy, and some of these other countries where the disease has spread very, very rapidly. So time's of the essence. I think the state has at least a chance to get ahead of this a bit. We have no widespread transmission occurring right now. This is the time we need to impose very strong and bold measures to prevent the transmission of the disease. By the way, that'll help the economy as well. We talked about the impact on the healthcare industry. If we can get that economy curve down a bit, we won't see the dramatic layoffs and other things that you're going to see if this disease does spike and impact the economy more dramatically. If we can spread that out, then the impacts would be less. But getting back to the reality of it, we've got now bars and restaurants closed. We're still in the air on the schools. I mean, there's a tough decision, and I'll give the LG some credit. If we do see communities where disease is spreading rapidly, we're going to seriously look at closing schools. I mean, that would make sense. We're trying to weigh the risks and benefits of closing schools, childcare, and all the things come into play there. But if things are changing, and if they do change and we go south and we do see community spread in particular areas, our strategies will be different than they are today. And we're going to have to go even more aggressively to try to prevent transmission of the disease.
But also though, what you're saying about the status that we're at now, if you're correct, it makes it more urgent that you stop potential people from coming in, right? And so is there going to be a quarantine place, for example, on anybody who comes in an airplane? I know that was up for consideration today.
Yeah, there are some countries, I particularly like the New Zealand model, where they have actually required quarantine for everyone coming into the country, both residents and non-residents. And my understanding is they recently have now banned anyone but residents coming back to New Zealand. When I say residents, individuals with New Zealand citizenship. We may go down that path. That could be a situation we're going in. I know our governor's considering all options at this point in time. But I think we're going to need to continue to take very bold moves to not only prevent the spread in the community, but also to keep the illness as much as we can offshore. But let me also mention that's a delay tactic. It is going to be here. We do need to get our community prepared and be able to deal with it when it does get into our community.
I have several questions from people asking specifically about the risk of public transportation, primarily buses. We already talked about airplanes. Are people safe riding a bus?
The goal is to keep people away from droplet contamination. So away from 6 feet if they're sick. We have to be as careful as we can. We're telling, as Bruce said, we're telling people to not go to work if they're sick, not go to school if they're sick. If people are sick and symptomatic, they need to not just not be on the bus, but they need to not be in public. Because at this moment, it's very difficult to get tested, although it's increasing a little bit, our capacity. So yes, it's a little bit risky if someone is near you and they're dropping droplets on you. The questions earlier about whether we're going to ban travel here. So I called for that today. I'm taking great criticism from the administration right now for this, but just the day before I just said it more discreetly today. Yesterday, the governor was very smart when he said that we should not encourage people to come for 30 days. That was smart. And so the specific nature of that is people should only return home, and if they are returning home, go into quarantine for 14 days, and we will be safe that way.
Let me make a quick correction, though.
Yeah.
He said that 2 days ago.
2 days ago.
It was the mayors that actually did something about it.
Right, maybe so.
Made it mandatory.
And mandatory on the restaurants. I'm talking about traveling into the state of Hawaii. Today, and I'm hoping that we do insist on this happening, and I believe he's going to approve this, although we'll know tomorrow, I suppose, that if we've talked to the many people, because I've been asked to work on the health aspects of this, and I hope that will remain the case. But here's the thing. Right now we have an opportunity, because I believe 25 out of the 26 individuals came as a traveler here or a return individual from a vacation, and that's where they caught it, okay? So to Bruce's point, we're right. We're lucky that we're not seeing a lot of community spread yet, though we don't know what the total background is, but we're not getting trounced by it. The idea to bring the hammer down, which is what we should do, and not have anyone come, return home, and be out in the community is a very good one, I believe. So I was glad the Gov mentioned it. We do that, we decrease these kind of cases, and yes, delaying is important, and maybe get some background resistance and immunity. If we do this, we have a chance to be an outlier and have less disease.
Let me ask Eric Gill on this point. And I'm going to, again, start with a question from a viewer. How can you social distance a bus full of tourists? And how difficult is it for you as a leader of people in a particular industry to actually have to be in a position where you watch the best way of mitigating a disease like this means that so many thousands of your members will lose their jobs?
Well, all of them eventually. Well, we have many members that work at Kaiser. They're busy.
They're
not
busy,
gonna
but
get
they're
laid
also
off.
frustrated, right?
Well, and there is a real shortage of masks. I mean, Kaiser's consolidating back to hubs partly because the supplies aren't there. And so, of course,
What is that? I don't.
what I mean to say is if you're treating sick people, you need multiple masks, you need multiple gowns, you need multiple booties and gloves and all those things. And I, I'm a Kaiser patient. My doc a couple weeks ago said people are coming in and scooping all the masks because they couldn't find them out there and they're
hate to
taking them.
laugh, yeah.
So now, so it would be a disaster, of course, if our members and any other healthcare professional have to treat sick people without.
Let me ask, though, back to the original question.
But yes, I mean, when the governor says people shouldn't come, people don't come. And we've had bookings, every banquet's been canceled, every major tour group's been canceled. That was the first impact we had. We still had people, individual travelers, sitting in saunas. They weren't going to walk away from their investment in their vacation. Those will be gone. No new ones are being booked. What are my members going to do? And so whether they get sick or not, whether the community recovers or not, we have our main industry unemployed. And the possibility that some of our employers might go belly up in this because the economic aspects of this are very clear and already being felt regardless of any public health issues. So we've got a problem where I had to tell my members yesterday and today that we have to be prepared for all of us to be unemployed. And if we're all asked by the government to shelter in place, we're not going to work. Is the hotel going to be open with nobody there to work? It's not. So we're in a situation where we have real economic damage to families right now. People are burning through their what little savings they had. Most of our members are paycheck to paycheck. We had a big strike about that a couple years ago. One job should be enough. Everybody didn't give up their second job, and now they don't have a second job. We have an economic disaster here in our industry, and the public health aspects are, as you say, directly contradictory. If we're saying people don't come, if we're going to close our borders, our jobs are dead.
Right. But is that, oh, go ahead, sorry.
I think one of the basic principles of getting through any disaster, whether it's an epidemic, tsunami, an economic crisis, is partnership and building the alliances, and again, building that resiliency at the individual community level as much as we can. And one of the ways that I think is really important for your viewers to understand is that they're partners in this entire effort. So needing to be flexible, the way that we're delivering healthcare is going to change a little bit. So rather than going in and seeing your doctor in the office, you might do it over a telephone call. If you're being asked about symptoms, really important to be honest, because if you're not, you're putting people at risk. And reaching out to your neighbors and making sure that they're okay. If you have a kapuna living next to you and you haven't seen them in a few days, give them a call.
Yeah, we're anxious to have that kind of cooperation. Right now, we're getting our committees restructured to be able to reach out to every member, whether they're home or not, whether we're home or not. We have a goal to be able to do that. We have a structure. We're organizing it. We will be getting information out, and we're going to get information back.
That's how we
Let
get
me
through.
just ask, okay, I've only got like 2 minutes left here. Dr. Anderson and Dr. Reed, do we have a strategy for dealing with the economic disaster that we're looking at?
Yeah, as pointed out, there's no question the economic impacts are tremendous already, and they will continue. I think one thing I want to make sure everyone understands that this is a marathon. We're going to be at this for months, and I've heard 6 months, 8 months minimum. It's not something that's going to go away. So I think what we're going to have to do is work together to try to minimize the economic impacts, work in partnership, forgive loans, do the things that that everyone's talking about doing to get through this with the least impact that we can.
Let me look at
So a couple things, workers' comp, disability, we're going to do everything humanly possible, make sure we put pressure on people to not dump people off insurance, to give them every possible support in the community. What we have to be aware of is we have to stop the mass quick spread of this disease because we only have a finite number of ventilators. And we don't want to lose our loved ones. We will find the jobs back. The industry will return. People will love coming back to Hawaii. That's why we put the hammer down right now and slow things down, and then we return to normalcy.
Okay, great. Thank you very much. And everybody, separate. Mahalo to all of you for joining us tonight. And we thank our guests, Lieutenant Governor Josh Green, Hawaii's COVID Healthcare Liaison, Eric Gill of Unite Here Local 5, representing thousands of workers affected by this crisis, Bruce Anderson, State Health Director, and Stephen Hankins of the UH Medical School. Next week, we take a break from Insights. Next Thursday for the Kuhio Day holiday, we will be back on April 2nd as Insights asks, what's it going to take to expand early education in Hawaii? Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.